Good afternoon, North Dakota, and welcome to today's press briefing. We've got a lot of topics today to cover. We may have successfully skipped one press briefing yesterday, but perhaps in doing that, we've made this one twice as long. So in addition to myself, we'll have Executive Director of Human Services for North Dakota, Chris Jones, speaking. We're going to have some special guests. They're going to join us by video versus by phone, so that'll be a new technology attempt today, but Fargo Mayor Tim Mahoney, West Fargo Mayor Bernie Dardis, Cass County Commission Chair Chad Peterson will all be joining us, and then following that, Superintendent Baesler, and then again myself back up on a wrap-up. Let me begin with just a moment of gratitude before we jump into today's briefing as it relates to all of you and all the people that are working to navigate through these uncharted waters. It's been said that the use of imagination, the worst use of imagination is anxiety, and I just want to acknowledge, because we always lead with a lot of numbers, but we know that there are a lot of people that are out there that have a lot of anxiety around this, and whether they've got a loved one that's tested positive, or whether they have someone who's currently hospitalized, or even if you've just got a vulnerable person in your life that's living in a long-term care facility, we know that there's a lot of anxiety, and I know that there's a lot of worry that is out there. But as has been said, the worst use of imagination is anxiety. The best use is creativity, and I want to assure the citizens of North Dakota that every day when Team ND goes to work, we're trying to use our imagination as creatively as possible to try to come up with new solutions to protect the most vulnerable, to restart our economy, and to, in the process, save both lives and livelihoods. And so with that thought, we will head into today's numbers. The first, of course, is our case numbers, and we have 57 additional positive cases. That may seem like a high absolute number, but again, I want to right off the bat draw people to 2 points. One is at 2,211 tests. That's a new record for us in terms of completing tests coming through all the labs we work with in a single day. We also spoke of on Monday how we had a backlog, and that backlog continues to work its way down, and so this would include a number of the tests reporting from yesterday, the 24-hour period Tuesday, including this was some of the ones that were collected over the weekend. So there may be a little bit of a bump statistically because we've got multiple days data that may be commingled into this one, and so might have saying that the earlier days might have been slightly higher, this might have been slightly lower. That's why we've got to look at the trend lines, but overall the today's positive rate only 2.6%. Again, that is very low. That's right in the same range. We were at 2.4 Monday, 2.5 yesterday when we were going through this, but the cumulative positive rate there at 3.4% is the fifth, still the fifth lowest in the country, again, still behind Alaska, Hawaii, West Virginia, and Montana. And so again, very, very low. And with the testing that we're doing, North Dakota remains number 4th in the country per capita. And why that matters is that when we actually do more testing than all but 3 of the states, more testing than all of our neighbors, sometimes by a substantial amount on a per capita, then that gives us a better indication of. And so again, the key here is to focus on the percentage, not on the absolute number, because we may end up with higher absolute numbers because we're doing, in some cases, 3 to 4 times the rate of testing of some other states. But yet, even with all that testing, we have the lowest rate of positives and near the best in testing. That is a great spot for us to be in. And this testing of 57 comes on yesterday when we did not have a press briefing. We had 41 additional cases yesterday positive out of 1667 that were completed yesterday. As we were coming out of that, the machinery that was that we had the missing testing components back up online, and the team continues to work through the backlog, not as of midnight last night, but as of before this press briefing, we're down to about 1,800 tests in backlog, and so we expect that we'll have a large day in terms of number of tests reported tomorrow as we work through that. When we take a look at the net case breakdown, one of the things that we see here, and sadly, is that our deaths are now over 31. Yesterday we had the largest number of deaths reported in a single day since this has occurred, and sadly, 6 individuals in North Dakota, 6 North Dakotans have passed away. A woman in her 90s from Grand Forks County. I believe that's the first death in Grand Forks County of people that have died with COVID-19. A woman in her 90s in Cass County, a man in his 90s from Cass County, another man in his 90s from Cass County, a woman in her hundreds from Cass County. So congratulations on that family's great genetics to making it well past 100, and then sadly a man in his 50s from Cass County. But all 6 of those individuals had underlying health conditions, and again, as always, from the First Lady and myself, our hearts and prayers go out to the loved ones and anyone who's lost someone during this incredible time of this pandemic. Hospitalizations at 32 puts us at the top of what we have been at in terms of hospitalization. But again, we went into all of our physical distancing and North Dakota smart practices to preserve healthcare capacity, and we've done that. So again, nice job, North Dakota, in terms of our being able to do that, because we have, this again represents low single digits of hospital capacity with these hospitalizations, with thousands and thousands of hospital beds in North Dakota. In terms of the case trends, again on this, we've moved up to 710 active cases, but that's a net. We had 23 recovered, and then also, sadly, these 6 deaths, we had a net increase of 28 active cases following yesterday's net increase yesterday of 22 active cases. So it continues to climb upwards. But when we take a look at the overall positive rate of completed tests, and this is one of the White House gating factors, today's rate is 3%. That's the lowest cumulative 14-day cumulative we've seen since March 31st, so the lowest in over a month. And again, this downward slope of this line is again a reflection of the great work that North Dakotans did in terms of their great individual responsibility. Article out today that said that North Dakota was the 3rd least restrictive of all the 50 states, but it's fantastic to see these kinds of results because of all the great individual responsibility exhibited by North Dakotans during this entire pandemic. When we take a look at some of the county data, which we need to drill down on because we know that this pandemic is hitting certain parts of our state harder than others. We take a look at the active cases by county. This is a slide we showed on Monday. We've updated it for today, but between Cass County and Grand Forks, out of the 710 active cases, 57% of the active cases in North Dakota today are in Cass County, 24% of the active cases in North Dakota are in Grand Forks County. So again, 81% of the total active cases in North Dakota are in those 2 counties. And we naturally would expect to see, if we take a look at the case rate by county, we would expect to see more cases in our most populous counties. But if we take the active case rates per individuals in these counties, we can see that again it's above the state average. The state average is 9.3. We've got 3 counties that are above that: Burke at 14.3, Grand Forks at 23.9, slightly higher than Cass County at 22.4. But again, Cass and Grand Forks are more than double what the rate of active cases per 10,000 people. But again, this means that out of 10,000 people, 9.3 of them, or a very small percentage of that 10,000, actually have an active case of COVID-19. When we take a look at positive test rates by county, again, and this is a function, the numbers on this slide, percentages, this is the number of positives divided by the number of tests. And we see here that in Grand Forks, it's about a 7% positive rate in Cass County, it's 8.2 versus what was our earlier stated our 3.4% is conducted on the positive rates on average. And so again, these are Cass and Grand Forks have higher rates of positive. Dunn County is in that same group at 7.1%. But again, in contrast, we talk a lot about why it's good to be in North Dakota. The current numbers right now on positive test rates, again, for if North Dakota is at 3.4% in a state and about a little over double that for Grand Forks and Cass County. New Jersey today, 46% of tests positive. New York is down from the 40s. They're down to 31% still being positive this far into it. And of course, we have not ever climbed into double digits as a state. In terms of the next thing we'd like to announce, because when you say, okay, you've just gone through a lot of data, what does that mean? We've always said from the beginning that we want to be data-driven, and we want to, again, through the core functionality that we've built up as a state to manage, any epidemic. When we're managing that, what we want to do is we want to be able to test and test broadly and test rapidly and deploy testing resources. Then we want to follow up that with contact tracing of those people that were close or may have been exposed to those positives so that we can find more positives or people that were exposed that should be quarantining in case they do become positive so they don't become asymptomatic spreaders. And then we have to have the ability to quarantine or isolate people, and we have to support the people that are in isolation so that they can stay during that incubation period away from the general public. And this is the way that you actually can grind the spread all the way down to a halt with those three things. And so it's test, trace, and isolate is the way to think about the three words that we need to be able to do that. Well, if we've got two counties where we still have got a spread that's higher than the rest of the state, then naturally that would conclude that we need to drive more resources in those directions. We talked on Monday that we were. Today we're announcing the Red River Valley COVID-19 Task Force. And again, we need targeted action because as we saw here, whether it's the deaths being a majority of the deaths in the state in Cass County, the active rates, the number of active cases, the positive rate numbers that we've already gone over, we need to focus on these two counties. And the key of what we want to try to accomplish here is a couple of things: is prevention and mitigation within Cass County, and by Cass County, we're really also then talking about the metro area. When we still have room to do more testing, even though 8,000 tests have been conducted in Cass County, which is 22% of the total tests for the state, that's less than what we've tested on average in other parts of the state. So we need to do more testing, even to get up to the test, per 10,000 that we've done in other parts of the state. We do have rapid response teams that are headed out to the Fargo metro area for long-term care facilities, whether it's testing, supplies, deep cleaning, and to try to confirm COVID positives are cohorted in meaning that they're in an area of isolation if they're in long-term care, that the staffs that are serving those positives are only working with positives and aren't going from a positive to a negative in a long-term care, or through the collaboration that we've received with the great medical providers in North Dakota, in some cases transferring COVID positives from long-term care into a hospital situation. We've been doing all of that, but we need to do more. We have tested about 5.1% of North Dakotans, but in Cass County, we've only tested 4.6%. And so again, we need to keep driving that testing up. And while our rolling 14-day average for the state has dropped from over 6 down to about 3 in Cass County, we've seen a slight decline, but it's hovered around 10% over the last 9 days. And so, like many people in Cass County, we're also concerned about those cases and the fact they're not dropping. But again, it's important to note that even in Cass County at 10%, it's half. It's less than the national average, which is considerably higher. And so again, we're taking a deeper look at this in terms of where the cases are, how they're spreading, and what the context. And we've got to work again to really arrest the spread in Cass and Grand Forks, continue to work even more closely with county and city leaders and health officials. We've reached out to Clay County, Minnesota, because there's a strong workforce connection. We know that we've got people that work and live on and go back and forth on both sides of that border. The goal and the measure of the success of this task force is going to be to get the Cass County positive rate, to get it down to the state average. And there's a little bit of a math problem with that because it's one of the ones that's been pulling it up, but we'll keep driving that down. But there are areas that we want to focus on. Number one is prevention measures and testing. This will include more targeted testing of high-risk populations, especially long-term care residents and staff. Because again, a high percentage of the Cass County positives have come from either long-term care residents or long-term care staff. And so we need to go back, the places we have tested, we need to get back and do more testing. We also are going to shift our strategies. We had been successfully doing a number of big drive-through mass testings like the 1,000 people that we did at the Fargo Dome last weekend and weekends before. We're going to be establishing daily testing. It was available at all providers, but in downtown Fargo at the Family Healthcare Center, which is a fantastic nonprofit organization that's got a full clinic and a homeless clinic as well, that they're going to be making it, doing testing every day there, but it makes it more accessible because the location of family health care includes being very close to the where the Fargo transportation center is for public transit. And we know that when we're doing drive-through testing, then automatically we're missing out on populations that may be working during those hours, may not have access to an automobile, and may not have a way to get to the Fargo Dome. And so that's again, a shift where we're going to try to pick up some more individuals that we might have been missing. We also are going to be working to provide care packages, if you will, to long-term care staff and other workers. And whether those are resources, it's thermometers, hand sanitizers, masks, and other gear. And again, this isn't just for those that are, RNs or LPNs, but we really want to focus on custodial, food service staff, and CNAs and others that might be working hard. They are those that are doing essential services as part of these facilities, but again, may be taking public transportation to and from work, or maybe in housing situations that could include multi-generational housing. So we want to make sure that they've got everything they need to support them while they're working, or if they have to go into isolation, that we can support them. So there's going to be a dozen or so more different organizations in Cass County that have stepped up to be supporting the local community help with resources as we go through this. And some of that work from those organizations can help provide community resources for those that are non-hospitalized. And whether it's telemedicine through the family health care that is language specific and culturally appropriate, or it's helping manage isolation or quarantine with strong wraparound solutions. And we'll also be evaluating for solutions for those that may not have either sick leave based on their work situation, or may not have access to childcare. And we're going to work with all the employers, including all those in long-term care, to make sure that we're providing support. Statewide in North Dakota, over half of the cases attributed to long-term care are cases attributed to staff. And so again, we want to make sure that we're supporting those employers to support those staff. We also plan to provide a hotline to support people that either have got language or socioeconomic barriers, and connect them with counseling information, social services, or medical support. The task force will focus on ongoing monitoring of individuals, resources, and vulnerable communities, and do so while maintaining privacy and confidentiality. I'm pleased to say we've got a real all-star cast of task force members. The director is going to be, of the task force, will be the director of Fargo Cass, director of public health. She'll chair that. Desi Fleming, thank you for stepping up. 3 more of the task force members we're going to hear from here today: Fargo Mayor Tim Mahoney, West Fargo Mayor Bernie Dardis, Cass County Commissioner Chad Peterson. Also, Doug Murphy, Regional Coordinator of Fargo Cass Public Health Emergency Preparedness, Nicole Crutchfield, City of Planning Department from Fargo, Tammy Miller, Chief Operating Officer, State of North Dakota, Mylyn Tufte, State Health Officer for North Dakota, Chris Jones, who is here in the room, Executive Director, Department of Human Services. And again, we are reaching out to add representatives from Moorhead and Clay County as this plan evolves, because we know we can't be successful if we're just trying to solve contact tracing and testing for 2/3 of a metro area that is fully integrated. As this model plays out, if the need arises, we will replicate this model for Grand Forks County and Polk County. That would be for Grand Forks and East Grand Forks. We've been fortunate right now in Wapton and Breckenridge to have very few cases, but that would be a third border metro area that we could potentially take a look at. I've also reached out this afternoon. I was able to leave a message for Governor Tim Walz to let him know that we have this Red River Valley Task Force going. We're not asking anything from the state of Minnesota. And in fact, we're offering, because we would have the capacity to be able to do contact tracing in Clay County of people who may have tested positive at a health facility on the North Dakota side. And of course, we know that when we look up and down the border with Essentia and Sanford and Fargo and Altru and Grand Forks, the majority of the healthcare clinics and hospitals are on the North Dakota side. That flips when we go to Breckenridge, where it's on the Minnesota side. We also know that many North Dakotans get their prescriptions filled over in Moorhead or East Grand Forks because of the varying states' pharmacy laws. But again, we are one community. We are integrated healthcare systems, and when we have a pandemic with a virus that doesn't recognize the border or the river, we have to work in a coordinated way. And so again, we look forward to working with our partners across the border to solve these metro area challenges. All of this aligns with what we described earlier as the VP3, or the Vulnerable Population Protection Plan. This plan has been operationalized. We're continue to test long-term care facilities in Cass County and elsewhere. The VP3 is a statewide effort. We will be getting back in and retesting residents and staff until we make sure that we see a decline in the number of positives. Vulnerable population also includes how we take a look at people that may be vulnerable, not because of age or health, but because of where they may reside in a congregate. So it includes all those that are in correctional facilities, whether that's at the county or the state level. It also includes developmentally disabled care facilities, and it also includes homeless shelters and other sheltering activities or congregate living facilities, including domestic violence shelters. So broad-based vulnerable population plan. And as you know, Chris Jones is leading that, and will continue to work with local public health to support the testing operations that are unique to the Red River Valley area. Right now, we'd like to go to video. We've got 3 leaders from Fargo, West Fargo, and Cass County ready to share some remarks about the task force and share their thoughts on the COVID situation in Cass County. I see them coming up on the screen right now. The technology is working. Welcome, Mayor Mahoney. I just want to say all 3 of these leaders have been great partners right from the start in the COVID-19 part, and we're fortunate to have all of them serving the citizens of North Dakota. Mayor Mahoney, you're the lead-off batter. Take it away.
Thank you, Governor Burgum, for an opportunity to be involved in the conference today. I also want to thank West Fargo Commissioner and President Bernie Dardis and Cass County Commissioner Chair Chad Peterson for being in this important partnership. The formation of this partnership is a perfect example of continued and resilient partnership between local, county, and state governments during the COVID-19 response. The leaders of Fargo, West Fargo, and Cass County are unified in saying today we are refocusing on our efforts to targeted testing. As the largest metro in the state, the largest county in the state, we are and will do our part to be as proactive and methodical as possible while seeking to identify carriers of COVID-19 before we arrive at any potential outbreaks. We know that Cass County is leading the state in the highest percentage of positive cases, and we're not here to hide those positive cases. In order to prevent a carrier from spreading the disease, you must first detect them. Rather, we are actively seeking to identify them and further enhance our contact tracing efforts to engage in a deep dive into the scientific factors leading to the spread of this virus. We are concentrating heavily into data and analytics behind our positive cases to learn from them and to utilize what we learn into action. Continuing testing with a surgical targeted approach will be invaluable to our efforts to mitigate spread. We also appreciate the local flexibility afforded to us by the state and by Governor Burgum to select who we will choose to test. Testing will be the key to achieving an accurate and realistic picture of our community's infection rate. Testing efforts will focus on our most at-risk populations, which has vulnerable populations like long-term care and congregate living settings. This will help identify any more positive cases, including those who otherwise would not have been tested. We have a positive outlook on the metro situation, but now is not a time to relax. Continued diligence and action are needed now more than ever. We have learned a lot, but we are continuing adapting to this crisis by being dynamic in our approach. The formation of this task force allows us to do that even to a greater level. In partnership with the Governor and the North Dakota Department of Health, I have utmost confidence in our public health professionals, local leadership, and residents to respond appropriately and effectively in every challenge of the COVID-19 virus poses. Thank you for your continued leadership, Governor Burgum, and for your continued partnership. We stand ready to work with you and Team North Dakota on this initiative as well as future efforts in our unified North Dakota smart approach to COVID-19. And now President Bernie Dardis will speak.
Good afternoon. Thank you to Governor Burgum for inviting myself, Mayor Mahoney, and Cass County Commission Chairman Chad Peterson to today's news conference. Thank you to you, Governor Burgum, and your team for your leadership in response to this pandemic. Under their plan, the state has been able to get a handle on the virus, become a leader in contact tracing, and only suspend 7% of our economy for a few weeks. I'd be remiss if I didn't take this opportunity to remind our citizens that the continued success of our state depends on them remaining North Dakota smart and following the public health advice to stay home if sick, wash hands, social distance, and wear face masks or cloth face coverings to limit the spread. Our state is in a good spot, but we can't take our foot off the pedal. Therefore, we are here to talk about a new part of Governor Burgum's response, a local Cass County task force to continue driving our numbers down. The cities of West Fargo, and Cass County are ready to support the state's efforts with this new localized piece of the response. I'd like to invite Cass County Commissioner Chad Peterson next to speak.
Thank you, Mayors. Thank you, Governor Burgum, for inviting myself, Mayor Mahoney, Commission President Dardis, to today's news conference. Thank you, Governor Burgum, to your team, their leadership, and their response to this pandemic. Cass County appreciates all the efforts to increase testing capacity and decrease the number of positive cases inside our community. We'll be continuing to partner with our local government colleagues, state government colleagues to address the constantly changing challenges, opportunities to improve our response. We remain committed to establishing a strategy of locally executed, state-managed, and federally supported responses. With that said, Cass County represents a unique situation when it comes to the diverse population and the amount of people traveling to our area from rural communities. We are a regional hub, and I'll talk about some of that data here in a second. Cass County has the largest population of homeless citizens, the largest population of long-term facility patients and staff, the largest number of residents and medical staff. These are all populations that have identified as high risk and have been part of the targeted testing that has occurred so far. Naturally, the rates of COVID-19 tests are going to be higher within those people within Cass County, and if we continue to target these areas. With that in mind, the task force would like to take a proactive approach to the current situation and ensure the community that we're doing our part to support Governor Burgum and his team to create this task force and follow the North Dakota Smart Restart guidelines. We will partner with our local colleagues willingly, aggressively, to support the state's overall plan to help Cass County take measures to decrease the number of positives. Some of the things I want to touch on. We are a regional economy. It's hard for some people to understand, but roughly 30,000 people commute here to work every day. We have 2,000 people almost from Grand Forks, 2,000 people from Becker, 2,000 people from Richland, 1,200 people from Ottertail. Controlling the spread within Cass is imperative to the region. We're a regional population, a regional center of commerce. We'll continue to be that. So Governor, again, thank you to you and your team, mayors. Thank you to you. Thank you to the folks that made this digital visitation possible. And with that, thank you again, sir.
I want to say thank you to Mayors Mahoney and Dardis and Chairman Peterson. Wise words, all three, and really appreciate them. And I just want to, again, put a double down on Chairman Peterson. Again, regional economy, if we want to have health in the region, we need to make sure that we're controlling the spread in Cass County and as well as Clay County. So we're getting after it, and we're, again, working together to deploy resources to make sure that happens. One of the key elements I talked about that fits lines with this Red River Valley COVID task force is all the work that we are already underway with our VP3, or the Vulnerable Population Protection Plan. And again, we're going to have an opportunity to hear from Executive Director Chris Jones, I believe, right now. Is that true? No? Yes? No? Not? No? No? Okay, I got it right here. I got it covered, Chris. All right, you're good. You're here. Stick around for questions. Chris is here as backup, apparently. But again, as we talked about earlier, we want to make sure that we've got this plan, which includes vulnerable populations residing in the places I mentioned before the mayors and the chairman talk, whether that's congregate housing, long-term care, correction systems, but everything in this plan includes transfer protocols, how we do isolation and quarantine protocols within these facilities, testing and contact tracing strategies, making sure there's access to personal protective equipment, our ability to do rapid response capabilities, control of occupancy and movement of individuals, restrictions on visitation. So all been thought through with the providers. So again, want to say thanks to the Long-Term Care Association, all the medical providers, the great work that's being done by the corrections team and all those that work in whether they work in areas of homelessness or other vulnerable populations, the DD providers. It's been a great collaboration. Again, thank you, Chris Jones, for your effort to make sure that we're managing all this. That includes intermediate care facilities, assisted living, basic care, skilled adult foster care, and all the shelters we've talked about. And so again, thank you for all of that. And again, we'll have more updates on this, I believe, on Friday. But again, thanks, Chris, for all the work that you're doing to keep moving this ahead. The next up, we're going to talk about, we've got the Superintendent of Public Instruction here today. Lots of things always happening on the DPI front and some fun announcements to be made. So joining me is Superintendent Baesler.
Thank you, Governor Burgum, and thank you all for coming here today. As Governor Burgum said, I get to talk about the fun stuff, and today really is a joy for me to be with you today because we have some announcements about the tradition that we have long held in North Dakota for the month of May, and that's our high school graduations for all of our seniors that will be capping off and topping off their 13 years in K-12 education. And to have that conversation today, I truly want to thank my partners in the governor's office, the Department of Health, the Department of Commerce, and the Department of Emergency Services as I am here today to go over with you the North Dakota Smart Restart High School Graduation Ceremony Guidance. This COVID-19 pandemic has caused, as we have said many times, unprecedented disruption to our students and our traditional education delivery system. But recognizing the milestone that high school graduation represents in the lives of our students and their families, North Dakota has compiled potential solutions for local considerations. And it's important to note that each school district consider whether a graduation ceremony or celebration should be held. And if so, how can it be held while respecting the recommended guidelines from the U.S. Center of Disease Control and Prevention, as well as the North Dakota Department of Health? This guidance was informed by the North Dakota Smart Restart Plan that allowed for a phased, safe reopening of those limited sectors of our economy that were restricted to slow the spread of the coronavirus. As you remember, the implementation of the North Dakota Smart Restart Plan was based on meeting the following criteria: widespread rapid testing capability, robust contact tracing and infrastructure, targeted effective quarantine and isolation, protection for the state's most vulnerable, sufficient healthcare capacity, adequate PPE availability, new standard operating procedures for reopening, and plans for dealing with the resurgence or additional waves of COVID-19. So just as individual businesses have different factors to consider in determining whether to reopen, so do individual school districts in considering whether to hold graduation ceremonies or not. School district leaders should consider the status of COVID-19 within their own community and surrounding areas when choosing a plan for graduation. Specific data for each county can be found on the DOH website, and if an outbreak of COVID-19 occurs in your area prior to your scheduled graduation event, the state health officer, in consultation with the governor, may suspend any in-person portion of the event to protect public health and safety. So the ultimate question that we've all been waiting for, Governor Burgum's executive order currently requires all school facilities to be closed. Can a school still hold a graduation ceremony in a school facility? So the answer is yes. Graduation ceremonies may be held in school facilities with some limitations. The governor's order has been amended to allow graduation ceremonies, celebrations to be held using school facilities with proper social distancing, cleaning, and other safety precautions. Decisions around whether to host a graduation ceremony will remain at the discretion of local school boards and superintendents. So again, thank you to our partners. The guidance consists of several important factors. We provided 7 examples of potential ways to celebrate graduation, from the lowest risk to the highest risk. They include a virtual graduation ceremony, a live stream graduation ceremony, drive-in graduations, a graduation parade, outdoor field graduation ceremonies, conducting multiple ceremonies with smaller portions of your graduating class, and finally, the highest risk, graduation at larger arenas or auditoriums. The details and specifics and explanation of these examples from low risk to high risk are included in the guidance. And the guidance also includes planning for a graduation ceremony with some preliminary items to consider. For example, how will your attendees enter and exit the facility if you're having an in-person? It will be important to consider the use of restrooms and access to those facilities. There might be additional staff that might be needed to enforce these safety guidelines, and spacing should be marked in advance to calculate the capacity, number of ceremonies needed, and additional factors. We have addressed general guidelines and limitations such as social distancing when placing the seating for chairs, when using bleachers or bench seating, and also that physical contact and spacing both before, during, and after the ceremony. School districts will need to consider the maximum occupancy of their indoor and outdoor facilities because those facilities must accommodate the DOH guidelines for seating and physical contact. The issue of spectators and how your school district will determine how many additional family members can attend, and school districts may even consider having the graduates attend and only live streaming the event for spectators. It's very important to note that through all of this, people who are sick, unfortunately, should not attend this graduation ceremony. This includes students, their families, and school staff members. Members of vulnerable populations should not attend these graduation ceremonies if they are in person. This includes the elderly, individuals with serious underlying health conditions, or those with weakened immune systems. So additional safety measures should also be considered. There are certain factors that go into a graduation, such as the actual delivery of the diploma itself. There are suggestions within the guidelines of ideas shared, some best practices from our own school counselors that we've reached out to, our high school principals, as well as some national conversation that's going on. Processionals. Will there be processionals, and how will you ensure that those students are staying at minimum 6 feet apart from each other? And of course, the ever important, the intensifying of cleaning, disinfection, and ventilation during this time. So a lot of factors to consider as school boards make these decisions with their high school principals, their high school counselors, their students, their families, and their superintendents. This guidance will be posted on our DPI website under the COVID-19 update for our school communities, our families and students to take a look at. And before I leave you today, I'd also like to share one more exciting thing to announce. I'm happy to announce today that the North Dakota Department of Public Instruction is partnering with the Governor's Office, Forum Communications, and Microsoft's TechSpark team that has been in North Dakota for a few years now, helping us engage our communities. We've been partnering with these three entities to produce a virtual statewide graduation ceremony for North Dakota high schools. This is in addition to the local celebrations that we anticipate each school district will conduct. And this live ceremony will take place on May 30th at 1 o'clock Mountain and 2 o'clock Central Time, and it will be broadcast live on ABC statewide in North Dakota. It will also be available for live stream on Inforum, Grand Forks Herald, Jamestown Sun, and the Dickinson Press websites. Forum Communications is making this available to everyone, regardless of their subscription status, and it won't be behind that subscription paywall. This statewide ceremony will honor graduates from 181 North Dakota high schools, and Microsoft Teams will enable guest speakers from across the state to be part of this graduation celebration, including remarks from Governor Burgum, a musical selection by Tiger Lily, and we are working on securing some nationally known speaker or speakers to deliver an invocation and commencement address. So this live statewide ceremony is intended to provide another special opportunity to honor and celebrate our 2020 graduates and their families who have already sacrificed so much of their senior year celebrations because of COVID-19. So thank you, Governor.
Thank you, Superintendent Baesler, for covering all that. It just seems like yesterday that I was going through graduation with all my classmates from at that time it was called Dakota High School, from Arthur, Hunter, and Erie. The three schools had merged, but we know what a milestone this is for parents and teachers, families, and we know the hardship of missing out on your senior year, but we're excited that we're, again, thanks to all North Dakotans doing a great job on the North Dakota SMART guidelines. We're a state, perhaps one of the few, that's going to be in a position to be able to say with certainty for most of the state, hopefully all the state, that we're going to be able to have a graduations. But of course, as the superintendent described, this is not a one-size-fits-all approach. If you're a small school district in a rural area where we've had low or no cases, that's very different than if you're a large metro school district in one of our counties that is still more engaged in trying to arrest the pandemic. So as you make your plans on low risk to high risk, again, school boards who will be ultimately making this decision, working with your superintendents, make sure that you're taking into account the local conditions, your local facilities, to do this in a safe way. But again, those guidelines are going to be posted later tonight, and so you'll be able to find those, I'm sure, both on the DPI website as well as through ND Response. .gov. And so again, thank you, Superintendent. Thanks to your team. Thanks to everybody in the education community that provided ideas and suggestions. I think that that list of potential graduation ideas is a fun one, and some districts may want to do more than one. They may want to have a graduation and do a graduation parade and make sure that you tune in for the statewide virtual graduation, which will be in addition to the local. But again, this is a situation with the executive order that I've signed today adds the language that allows for the ability to have graduations. And it also, again, is delegating that ultimate decision making to those local school boards. And so again, local control with good local common sense judgment from North Dakotans. We know that we're going to be able to make the best of the situation that we're in. We also know that people are, asking questions about larger events, fairs, county fairs, reunions, rodeos, racing. All of these large events remain suspended for the time being, and our plan is to have additional guidance by the end of next week, when we'll be 14 days into our North Dakota restart. We'll have a better sense as we look ahead towards even additional loosening up on larger events. Next topic is the Bakken Restart Task Force update. Already been announced today, but the Department of Mineral Resources, working with industry and working with other agencies across North Dakota and the governor's office, has announced the Bakken Restart Task Force. And I want to thank Lynn Helms from DMR, and I want to thank Lieutenant Governor Brent Sanford and others that are leaders here, but those two and especially that help drive this on behalf of the oil industry. I think that we know how important this industry remains to the state of North Dakota. And again, it's over 50% in some years of the overall tax revenue that comes from this industry. And from a general fund standpoint, in the last 10 years or last 5 bienniums, it's ranged between 17 to 24% of general fund over the last 10 years. So very important that this industry, which is facing, I'd say the biggest challenge that any of us are facing in the state right now are those that work in the oil industry or those communities that are surrounded by that. But we want to focus on this Bakken Restart Task Force in 3 areas. One is regulatory relief, which is, again, making sure that we're cutting red tape, getting our regulatory agencies to work as one towards identifying, streamlining regulations and clarifying and communicating existing relief efforts. The second thing on the Bakken Restart Task Force is in terms of economic stimulus. So far at the federal level, there has not been relief for the oil and gas industry. And again, identifying all the existing programs, funding sources, and taking a look at all of the challenges, whether that's abandoned well plugging, environmental remediation, research pilot projects, getting the oil field service industry back to work. These are all things that we have to take a look at broadly across the whole industry. And we want to, lastly, if first is regulatory relief, second is the economic stimulus, is how do we get things restarted. The third is going to be focused on the long-term recovery. And this will include the consideration of tax release, low-cost financing, and other elements to make sure that when the industry comes back, that it does make its way to North Dakota as part of that restart, because we know that there are some costs it costs more to do business in North Dakota in this industry than it does other places due to distance to market. So transportation costs is higher. Winter itself presents some additional challenges. Our tax structure here is higher than some other states. And so again, we need to take a look at everything to make sure that when this industry comes back, that it comes back to North Dakota and starts here. The Bakken Restart Task Force will be meeting regularly to focus on these areas and maintain a list of actions. More information is available at dmr.nd.gov/oil and gas. And again, just for some startling facts already in terms of how much this industry has been not declined, but I would say free fall. 6,800 wells have already been shut in North Dakota. That's amounting to over 450,000 barrels a day of production. Last year, we would have had more than double this, but today there are 27 rigs operating and only 5 frac crews that are remaining running in the state. Our oil and gas industry contributes over 72,000 jobs in the state of North Dakota. The forecasted was to generate $4.9 billion in direct revenue. From July 1, 2020 through July 30th, 2021, that would have been 57% of all revenue collected by the state during that time frame. So again, we are in true partners with this industry. Establishment of this task force and its focus on the state's energy future is a critical element to protecting the jobs and forging a smart path forward during this incredibly unparalleled time for our communities and our energy economy. The task force will include a broad set of people, including those from Mineral Resources, Public Service Commission, Environmental Quality, Trust Lands, Pipeline Authority, Office of OMB, Tax Department, the Commerce Team, the Bank of North Dakota, and input requested from various industry subject matter experts. So the good news is we have a lot of folks that currently work in the state of North Dakota that are deeply familiar with this industry, and we're going to put our best minds forward on trying to make sure that the Bakken Restart Task Force is really engaging to help this industry get going as demand returns globally. The unemployment numbers for today are the regular claims 2013, the pandemic unemployment assistance claims 394, the pandemic emergency unemployment claims 410, and total regular claims since March 16th now topping 70,000. They're coming in at 71,864. The PUA claims 10,732, and the PEUC claims at 11,513. The trust fund balance remains at $114.9 million for unemployment. Next topic is behavioral health. For many that are in recovery, meetings can provide support and strength needed to stay on the recovery path. And as COVID-19 has limited the ability to interact in face-to-face settings, those in recovery may search for new ways to access support in support of community while protecting their own and their loved ones' health. There's a free online recovery tool that offers 130 weekly online meetings for those that are in recovery from the disease of addiction or seeking help in this group setting. InTheRooms.com is this tool, and it's a global recovery community providing support from around the world. It's got a vast array of content and information, member blogs, daily affirmations to expert content, a recovery program database that can find treatment centers near you. And In the Rooms is for people that are already in recovery, those seeking immediate help from any addiction, and for the families, friends, and allies of individuals seeking recovery. Visit intherooms.com, or also you can download it on the App Store or get it in Google Play. Under the good news section for today, we're excited to announce the Federal Administration for Community Living, or ACL, has awarded the North Dakota Department of Human Services a $300,000 grant to help meet the needs of older adults and people with disabilities. This grant funding will help us bring needed services and support, including communication solutions, to those individuals who are at increased risk of the coronavirus complications because of their age or underlying health conditions. Using this funding, the Department of Human Services is partnering with ND Assistive and the Long-Term Care Association to identify and provide technology solutions to nursing homes and basic care facilities, especially those in rural areas, so that family residents, their families, and caregivers can stay connective. So again, shout out and thank you to ND Assistive and the Long-Term Care Association. ND Assistive will be distributing assistive technology devices to access the internet and telephone services, and will provide the training to the participating facilities. General information about the services and supports for older adults and people with disabilities is available online at a searchable database at carechoice.nd, assistguide.net, or by contacting the Aging Disability Resource link toll free at 1-855-462-5465 on weekdays between 8 a.m. and 5 p.m., or you can email carechoice@nd.gov. We're grateful for this additional federal funding authorized in the Corona Aid, Relief, and Economic Security, or the CARES Act, and we're also thankful that we've got a well-established network of community partners who work with DHS and other state agencies to help older adults and people with disabilities stay healthy and live independently and stay connected to their families during these challenging times. Closing out for today is gratitude, and of course you may know it's been on the front page of many papers across the state, but today is the first day of Nurses Week. In any year, we are incredibly grateful for the care and the support of all the nursing professionals who care for our long-term and emergency health needs. Our nursing professionals share in the joy of welcoming new lives and providing the comfort in our last moments. They provide care and support for the smaller triumphs and injuries along the way. They endure the demands of the profession to answer the call now in these dangerous times for healthcare workers, often sharing in the joy and sorrow of their patients. And while our nursing professionals are among the most deserving and in our respect and admiration at any time, but our deepest gratitude is most empathetically given right now to those men and women who are on the front lines in the fight against COVID-19. Leo Buscaglia, the author, often said, too often we underestimate the power of touch, a smile, a kind word, a listening ear, an honest accomplishment, or the smallest act of caring, all of which have the potential to turn a life around. When I saw this quote, I thought about nurses, because in addition to the great care that they provide day in and day out and providing to people that are in stress because of this pandemic, they often, in addition to the medical care, they are providing the power of a touch, a smile, a kind word, and a listening ear. And their acts of caring certainly have turned lives around. So again, thank you to all of our nurses across North Dakota for all the great work that you're doing. We'll stand now for questions. And again, I see we've got Tammy Miller, our Chief Operating Officer, Chris Jones, and Superintendent Baesler here to answer questions, and we'll fire away. And the first question we're going to take is, do we have one online? Start there.
Renee Jean, Williston Herald. How many of the tests taken in Williston on Monday have been analyzed? Are they reflected in Tuesday's or today's totals?
Well, today's numbers would be Tuesday's numbers, because when we report at 11 o'clock this morning, that's for the 24-hour period from midnight to midnight for that day yesterday. So I do know that today's numbers are yesterday's numbers. I don't know the number of Williston's collected tests, how many of those are in Tuesday, but we can find out and get you that information. Okay, we're going to go to Tom and then Jacob.
Governor, within the hour, Williston Trending Topics has reported that 2 of the tests that you took on Sunday at the Bethel Home nursing home have returned as positive tests. Tammy, the administrator at the Bethel Home, says that they are grateful to the governor's office for sending out that testing to allow them to protect their residents. Question, are there more than 2 that are coming? And what can you say to the families of those residents to assure them that their family members are taken care of?
Well, I think that the first thing, this might be a chance where I'd have Chris Jones come up, but to talk about the Vulnerable Population Protection Plan as it relates to what actions we take once we find positives in nursing homes. And you had multiple questions there, Tom. One of them was, are there more coming? I don't know the answer to that, because we release by county at the state. I get the information by county. It's up to the facilities themselves to share that data. But what I would say to those families, because we've been experiencing this from the start, and for those that don't have no loved ones in congregate facilities right now, then I would say that you are spared the anxiety of finding out not only that your loved one may have COVID, but you might find out that your loved one is in a facility where COVID exists. And we know that the minute that happens, that creates stress for every single family who's got a loved one there, which is why we have been from the beginning so focused on trying to help all North Dakotans understand that the whole North Dakota SMART approach was about the 20% or so of population in our state that is either has an age or an underlying health condition. And then we have a smaller percentage that live in congregate living. They're more at risk. And as we're learning, it's also they're at risk, but so are the people that work in those facilities. And that's why we're concentrating so much energy around that through the Vulnerable Population Protection Plan. But I would maybe ask Chris to come up and say a few words about when we get positives for the first time in a long-term care facility, what are our next steps? We know that there'll be more of this coming. I think we're up to 36 out of the 218 in the state. There's 218 either assisted living, basic care, long-term care facilities. 36 out of 218. That's one of the best records in the country in terms of having the fewest facilities that have active COVID cases identified within them. We want to keep it that way, but there's more work to be done. And as many people are thinking about graduation and going back, and we're getting back to normal. Nothing has changed in terms of the risk profile for someone who's in long-term care, and that's why we're still working around the clock here. There's nobody letting up the state of North Dakota because our focus is around these vulnerable populations. So, Chris?
Thank you. So, as it relates to that, as we get notified of positive COVID tests, we have a team that calls immediately to understand what's going on. On ND response is the algorithm we're following as it relates to who goes in. So depending on the number of positive residents is different than the number of positive staff, because it's much easier to quarantine staff. You can furlough staff, you can't necessarily furlough residents. So from there, we go through and we look at the ability of that nursing home to isolate and quarantine those residents, whether it's on a unit or within a block of rooms. We also look that they can quarantine or cohort the staff, so that staff who are serving residents who are COVID positive stay with those individuals and could have different PPE requirements or personal protection equipment requirements than those that are not serving COVID positive. We also then go through their PPE supply. We go through their cleaning supplies, and then we look at the ongoing patient residents. And as we're building this up, it is becoming more meshed together with the overall testing strategy and the serial testing that needs to be done, because ultimately the way the virus gets into these institutions or these congregate housing settings is through outside individuals. So it's so important to be testing the staff on a regular basis and building up our muscle in that way. So that is the long and the short of it. We still have done more transfers as well as it relates to those who have become COVID positive in a congregate housing setting. We are moving them. We are still working with the hospitals, but we're also looking at alternative methods to best serve those who are COVID positive, because at the end of the day, every time this needs to be an individual decision, based on their health status, based on the health status of those around them, based on that skilled nursing facility, and keeping everybody safe. So it's, while we have specific algorithms or thought processes that we use to do this, we still have to look at this as a case-by-case basis, because we're trying to protect and minimize loss of life across the entire state. So.
Can you tell us, Mr. Jones, the two that have been identified as positive, are those staff or are those residents?
Specifically in Williston, right now I know it is one staff and one resident. So, already the team, I've got a brief update, but already the team has been in communication with them on setting them up.
Can you give us the update?
That's the update I have so far for you, sir. I will make a phone call as soon as this is done for a one-on-one with you.
Thank you, Chris. Jacob, and then Jeremy.
Governor, a two-part question.
Mostly about the Red River Valley Task Force. I guess the first part of the question is, obviously there are other parts of the state that could call for something like this. Grand Forks has already seen an outbreak. Is there a possibility of having other task forces like this set up in other parts of the state? And secondly, is this task force meant to be in addition to the state's efforts, or is this meant to be more of a decentralization, more hyper-local approach for the later phases of the response?
The answer to your first question is yes. I mean, we will set up additional local or regional task forces as necessary to make sure we're serving the unique needs of those communities if we find that we're not getting the kind of slowdown or arresting of this pandemic like we're seeing across the state. We're making great progress in a lot of places. We would like to see more progress, particularly in Cass and Grand Forks. I think the things that are unique and why it's called the Red River Valley Task Force as opposed to the Cass County Task Force is this is just a strong signal that the virus doesn't understand that the border exists. And while we may have 2 states and 2 county health departments, this is something that these metro areas deal with all the time. I mean, there is one Chamber of Commerce for Fargo, Moorhead, West Fargo, Dilworth. There's one EDC, Economic Development Corporation. There's one Convention and Visitors Bureau. That took some cases a decade for those organizations. Instead of having 3 come to 1. We're still in a position where when it comes to a pandemic, we're trying to deal with one metro area with multiple different public health, and particularly when it comes to 2 states, we have to work extra hard to achieve the collaboration across state border to make sure, because you won't ever be able to stop it if you stop it on one side of the border, but it comes across every day from the other. It doesn't matter which way it's going. So this is implying that we've got to figure out a way to work even more closely together to solve this problem, particularly when we may have people that are, working in long-term care facilities in one state that are living in the other, or vice versa, or working in healthcare settings in one state and living in the other. As Chris just said, I mean, one of the ways it gets into these facilities is when staff are moving in and out. And right now, part of my offer to Governor Walz is we could pick up and do contact tracing of positives in Clay County, because right now it's not clear that that's being done. And so we want to make sure that we would need their help on if there was an isolation order, that would have to come from a Minnesota health officer, but not a North Dakota one. But again, we've got some bandwidth to be able to ramp up on contact tracing that might, as step 2. Step 1 is testing. We do know that a lot of the testing that's been done in Cass County has included people with Minnesota addresses. We're happy to do that and keep doing that, because we do healthcare, and same in Grand Forks when we were testing, even when we were testing at the situation with a large outbreak there, they had employees at that facility lived in the Minnesota side. We tested them in North Dakota. They got reported as part of the Minnesota data. So this is not new that we haven't. We've had collaboration across the border, but we got to dial it up and really recognize that in these metro areas we have to work together.
I'm sorry, Governor, but if I could just bring up that second part of the question, then is this meant to be in addition to the state's efforts, or is this meant to decentralize the state's efforts?
No, I'd say this is an amplification of the state's effort, is the way I would phrase it, because we're taking everything that we've been doing already with great support from Mayors Dardis and Mahoney and Chairman Peterson. They've been fabulous partners through this whole thing, but we all sat down, all agreed we can do more, we need to do more. And so bringing in more organizations at the local level to assist on all aspects of it, whether it's the testing, whether it's the tracing, and whether it's supporting people while they're quarantined or isolated, and again, in reaching those populations that we may not have been reaching when we were doing the drive-through testing. So more focused and more supported.
If I may, just another follow-up on that. We've been
actually,
I'm sorry, it's just the momentum of the question.
I'm just looking at your partners over here. They're waiting.
I know. We will get to the radio legend in a second. We've been in the state of emergency for about 2 months now. What makes now different to set up this task force?
Well, I think it's this thing we've talked about all along, which is several months ago, we did not have testing capacity. We didn't have contact tracing capacity. We didn't know what we know, the things we know now. And now that we can actually project capability into a community, whether it's us projecting the ability to test every single person who resides in long-term care and every staff person, which we will get done by May 9th. That kind of being able to do that and do the community testing and do the task force. So again, this goes back to the enormous effort to actually build some of the nation's best contact tracing capacity and the nation's best testing is what allows us to do this that we're doing today. And so that's what's different. I mean, we got the capacity, and then we've also where we're at right now is when 3-4 weeks ago our highest numbers were in the West. When the outbreaks were starting, it was in the western part of the state in certain counties, and with that seemingly, at least for now, in better shape, that again allows us to with this higher capacity to really get after the places where the numbers. I mean, if you want to beat a pandemic, you've got to put resources where the spread is happening the most, and right now that's Cass County. Jeremy, and then Dave, and then Lane.
So I'm wondering, does the establishment of this Red River Task Force make testing more available to the average person who doesn't live in a congregate facility?
I don't think it'll make it. Hopefully, testing in Cass County is widely available. I mean, all providers have tests. If you've got symptoms, call your provider and get tested. If you don't have insurance, call, get tested, because COVID testing is supported. I mean, federal government and others. So it shouldn't be an economic barrier, and there shouldn't be an access barrier. But one thing we do know in our larger metro areas, some people don't have a car because they choose not to have a car. They rely on public transportation. Other people maybe economically, they might be in the workforce. They could be working. They could be working in a custodial or food service at one of our hospitals or our long-term care facilities, but they may be using public transportation. So drive-through testing wasn't catching them. And so again, we're with a partnership with Family Healthcare and with all the providers there. Again, we want to make sure that anybody that wants to get tested that's symptomatic can. The other piece with contact tracing, when we have a day like today where or the last 5 days when we have maybe 30 plus contacts in Cass County that come back positive, we are, again, with our contact tracing team, within 4 hours trying to contact that person, find out who might they be living with. Is it a multi-generational situation? If it is, we probably need to be contacting all of them and arranging testing for them. So I'll call this targeted outbound as opposed to just mass drive-through. So it's a redeployment of the capacity we have to be more targeted, again, because the faster we can find positive cases and get them isolated, the more we can slow this down. And so we are searching to find additional positives. So again, when you're in this effort of search and contain, we may see the numbers actually going up, but for an epidemiologist, that means we're winning because we're finding it and then we can contain it. If we don't know what's there, it could just be spreading unknowingly.
Just a quick follow-up there. If the testing criteria doesn't change for people in Cass County, where specifically demographically are those testing numbers going to be ramped up? Well,
I would say the testing is going to be driven by contact tracing. Because if we've got, again, every day there's if you have a county that comes back with tests and none are positive, there's no work for the contact tracers to do. If you have a situation where we get 30 plus back in a day, and we know from the work prior to this, on average, that a person that was positive had about 6 individuals that they would identify that they would have been in close contact with. But that range, that's the average. I mean, we've had, people that have had dozens. So there's a lot of work for us to do. And when we identify those close contacts, we will be calling those individuals regardless of if they're somebody that was commuting in from Otter Tail County, we want to be calling them. If it's somebody who was commuting up from Richland County, I mean, you heard the numbers from Chairman Peterson. I mean, there's thousands of people a day in the workforce that commute from up to 60 miles away in, work, and go back home again. So we had a positive, find their contacts, trace them, and invite them to come in for testing, and then get them involved in quarantining if they've had close contact. So that's again how you stop this sort of spider web of spread is with not random testing. random testing plays a role in, as they call that, the sentinel testing, but the more targeted we are, the more quickly, and the better we do contact tracing, the more quickly we're going to be able to arrest the spread. I'm going over to Lane, and Lane, just for those that can't see Lane, he's always the man behind the camera. He was wearing an Illinois State Redbird shirt, and now he's wearing a University of North Dakota Fighting Hawks shirt. And I just know that we've got it. Some people are going thumbs up with that around the room here. Mike Nowatzki is, but we've got to get Lane some other sports gear if you're going to keep showing up here every day.
State graduate, so that's why.
Oh, congratulations! Cool.
And
were you there at the national championship?
Yes, I was. Sadly.
Okay, good. Well, I'm glad you were there.
Thank you. The UND is just to localize myself. It goes with my high school colors. So.
Okay. Well,
the question is, Governor. There's been some murmurs that the White House might start phasing out the coronavirus task force soon. Was wondering if you had heard anything about that, or any other governors that you've spoken to, and if that will influence your decisions going forward?
I haven't heard that, and was on a call today with governors from around the nation, organized through the National Governors Association. No talk of that, and I would say from that governor's call, I mean, all you can take away is gratitude, because when you look at some of the states are still in the thick of this pandemic. Some of them still have numbers that are not trending down. Some states are still losing hundreds of deaths a day, and some are still weeks and weeks away from reopening. And so I would just say that we're feel very positive about where we are. I'd also feel positive because of the way we were, and again, some of it's the fortune being the good fortune of geography. Some of it was, that we maybe don't have an international airport in our state. I mean, that's sometimes you wish we had one. And when you're in a pandemic, you're glad you don't, because we know that this was spreading globally. But I would also say that, our ability to direct some of the CARES Act funding that states receive towards economic restarting is also a gift, because other states will consume the entire amount of their CARES Act just fighting the healthcare side, and they won't have any money left over for economics. And as we've already announced with those Bank of North Dakota programs, what we're going to be able to potentially do with unemployment insurance fund, we're fortunate that we have been able to direct our time, our attention, and our resources towards the economic recovery while still managing the pandemic. So that's a good spot. But haven't heard if they stop doing it. The task force officially at the White House will keep going with everything we're going here, and I'm sure that all the governors' associations will continue to keep collaborating together, because they've been a great source of best practices for each other as each state manages through this. Going online, and then, we're going to go to Dave first, then we're going to go online. Okay.
Superintendent Baesler.
Thank you, Dave. I should call on you earlier to come save me, but Superintendent Baesler, welcome back to the podium.
A couple of questions for clarification. Number one, you say it's up to the districts to decide how they're going to hold graduation ceremonies. Do they have to report to you, or are you going to be giving them some advice if they ask for it?
So the question was the decision to have a graduation ceremony and what type of ceremony or event is being left up to local discretion and local district decision-making authority. And the question was, does that school district need to report to me the type of ceremony or the type of precautions and submit a plan of such? The answer is no. So the decision lies with our local school boards, as Governor Burgum mentioned, along with their superintendents.
Would they ask you for advice if you wanted to give advice?
So yes, the question is there, would they ask me for advice? Certainly. In fact, while I've been sitting here, I have about 6 or 7 questions in my inbox, and my email inbox, about specific, can we do this, can we do that? And that's truly, as you've heard me mention many times, just so proud of the team that we have at the Department of Public Instruction, and there's 80 plus of us, give or take a few, and that's what we do. We provide that technical support, that assistance to ensure that we're that customer service-oriented agency where our local school board members, I have a standing call every Wednesday evening with our locally elected school board members since the COVID event has started. And so I'll have that tonight at 6 p.m. with those school board members dialing in. We have 120-ish every week that we've been having. I imagine there might be some more on the call this evening, and that's what we'll do, is answer as many of those questions as we possibly can. Thank you.
I'm just wondering, do you worry that putting this decision in local control could pressure school boards or superintendents to hold a graduation even where it might not be safe to do so?
Certainly. So I thought your question was going a little bit differently. So the question that was asked was putting this decision in our local school district members' hands, and a school board member hands. Do I worry that that pressure of the school board members may encourage some communities to host events that it might not be as safe as we'd like them to? As a former school board member myself, I was a school board member for 9 years and a president of Mandan School Board for 7 of those 9 years. I know very well how the pressure of being that locally elected board member within a community where your children go to school, where you shop and fill gas in the community with your friends and family, how intense that can be. But with that being said, too, I also recognize that the graduation ceremony is a very big and important occasion for each of our communities. The elected responsibility of being a school board member is one that board members never ever take lightly, and they are accustomed to having people lobby them, if you will, as they're getting groceries or attending, Sunday church or whatever it might be. But I would say that they have a great organization. The North Dakota School Boards Association is a great organization that supports them with those decisions and navigating that. So I have high confidence in our school board members across the state.
We'll go online.
Fargo, would you consider, or is it possible to consider, executive orders specific to Fargo and or Cass County?
It is possible, and yes, we would consider those executive orders to specific county. We've said that before, so that shouldn't be news, but we'll use all the executive powers we've given to try to protect the health and safety and the lives and livelihoods of North Dakotans. And right now, we think we've got a great plan without an executive order, just using this Red River Valley Task Force and the great collaboration that we've had through the get-go. So I don't anticipate right now that that's possible. But again, we've seen, we know that the potential for this virus is, if we don't take the right actions, it has the potential to flare up and spread. And if the numbers aren't going the right direction, we'll use every tool that we have available if needed. But right now, our favorite tools are individual responsibility and great collaboration with local partners, and that local collaboration has to extend now into Minnesota to make sure that as we keep building our skill set around testing and tracing and the isolation, that we can use the tools we're doing and use those with more focus and better data, and we can get the results we want that way. Okay, one more online.
Mike Smith, 660 KYZ in Williston. We're seeing county fairs cancel up to 2 months ahead based on your guidelines for graduation. Do you feel that this decision may be too hasty?
I can't make a judgment because could never second guess the challenges for county commissioners or county fair boards that are making those decisions, because maybe they've got lead times or deposits or non-refundable deposits, and I'm sure they're making the best decisions they can with the data that they have. That's what all of us have to do every day. So I wouldn't try to characterize those decisions. I would say that we're not shading or leaning one way or the other. We said earlier in this conference that we would have answers by hopefully the end of next week, so then we would have 2 weeks of data of where the numbers were trending after we began the North Dakota Smart Restart, and then we would have additional guidance for large events. But if you're an epidemiologist, your greatest fear is large events. I mean, because you can do a lot of containing. And then if you've got an event where you've got some positives in a large crowd, that's how these things flare back up again. And whether that's, in a school building, in a church, at a county fair, or at a graduation, again, which is why it's important that, the graduation, follow people as they proceed with this, they are not required to have graduation. They may have graduation. Look at the rules closely and decide if you can do it safely and smartly. And again, what Superintendent said, make sure that that you can keep vulnerable populations from attending, discourage attendance, because that's, again, if we're all trying to find this balance of saving lives and livelihood, then we've got to try to operate under with some new thinking about how we think about approaching that. But again, I would encourage the people making those decisions about summer events just to stay tuned. I know it's difficult to sort of keep waiting on this, but we'll have better sense of where we are a week from now, or more, about 9 days from now, week from Friday. A couple more, and then we're going to wrap up. So I'm going to go Tom and then Jacob.
Governor, you have a lot of support out in Williston in that area, but frustration is pretty high today after Monday's cancellation of the Tuesday event and the way it went down, because folks are wondering. In the morning, they started the testing for frontline workers. Then it was changed to everybody can come about 11 o'clock. Then at 12:30, it was changed to no testing tomorrow for the general public Tuesday. Question is two-part. How did you not know that there was going to be a problem on Monday? Did you know, when did you know that the machines were giving you problems? And secondly, when will you be back out in Williston for this testing?
Again, I have got a lot of empathy for people that were frustrated about the fact we had to postpone testing events. I was one of those people that was frustrated, so I've got a lot of empathy. The good news is that, machines are up and running. We've got some other machines that have arrived today that are in the process of being validated. So our capacity is growing to the point where, we were setting expectations assuming that we had perfection in terms of all lab equipment. And we're running this lab equipment 24 hours a day. That's something that's never been done before. And we're running new lab equipment, and we're testing all the supply chain. So think of it like running an engine at 9,000 RPMs and doing that for about a month, and saying our plan is we will never have we'll never blow a valve or have a breakdown. Well, that basically is what happened. I mean, we put a lot of pressure and stress on the system, and we had a breakdown. The good thing is that, like a race, like a good pit crew, the team leapt into action immediately. Creatively found the parts that we were missing, got those from NDSU, got things back up and running. And so great respect for people doing that. But when we, going forward, I think the lesson for us is that we should set expectations with the public to have a little bit of buffer between perfection, because some of these lab machines, they're sensitive lab instruments, and maybe they weren't designed to be running 24 hours a day without ever any kind of a breather. So as we get more equipment, more capacity, more people trained, we'll have a little bit of buffer, and hopefully we can, again, you want to set expectations then exceed them, not set them and come in below. That's a number one thing when you're anytime you're dealing with customers or dealing with the public, and we didn't get that done on Monday. So that was something we want to avoid doing in the future. As far as the exact plan on going back, I know that there's plans that are in place. I don't know exactly what the dates are, but I'm sure that if somebody has them, we can get them to you, Tom, in terms of when we're heading back to Williston. Okay, one last question, and we've got one online and one from Jacob. Those are the last two questions. We'll finish with Jacob. You're gonna be the closer today. Danny, you got one?
Sure. Sorry.
Hard to pick. I know you got a lot. You're managing a lot of.
Jean Shemp, Hometown Radio Group. Until today, it's been assumed by many that those cases reported as long-term care facilities are residents only. Do these numbers also include staff, and can those numbers be broken out?
I'm looking to our team. I believe we have been reporting them both ways. At least I thought we had. People are nodding. And so, Gene, we can get you a pointer on where to find that information on the breakout between staff and residents. And I know for sure that I think I've said from here from the podium before that it was about 50-50 and remains, we can get more precise than that, but that's been the case since the beginning. Jacob?
Group of people that are collecting signatures for a ballot petition. They're suing the Attorney General over being allowed to collect those signatures online. Wondering if it's within your purview to write an executive order over that kind of thing, and if that's something you would support.
I'm not familiar with that one, and I would let the Attorney General handle that one. We've got a Secretary of State. Okay.
Secretary of State.
Okay. Well, I'm not familiar with that one. I'll have to dig into that one. That one hasn't hit the radar screen for me yet. Okay. Thank you all. And we got Mayor of Fargo. Does the Mayor of Fargo want to say something? I see Mayor Mahoney here. I was hoping maybe you were going to take some of the questions they were asking me here, Mayor, but thank you. Thanks for being part of this. Go ahead, Mayor.
I just wanted to say, Governor, we've talked to Mayor Jonathan Judd from Moorhead and with Kathy McKay, part of the Clay County Health. They are going to work with us. They're very happy to be part of this task force that we've assembled. And he's going to be talking to his governor as well to see what they can do for resources. And the last thing I have to say, because you always talk about your wife, I have to say Happy Nurses Day to my wife because I got to get flowers as I go home. Thank you.
Well, good. Dr. Mahoney always got the right prescription there, so I'm glad you're picking up those flowers. But again, gratitude to all those nurses. Thank you, Mayors Mahoney and Dardis and Chairman Peterson. And great news that we've got additional collaboration already happening with Clay County and with the Mayor of Moorhead, Mayor Judd. So again, thanks for tuning in, and we will see you all Friday at 3:30. Have a great day. Thank you.